Len Nichols is a frequent advisor to decision makers in government and in the private sector.
The ratio of family premium, what it costs to cover a family, to median family income. That's income in exact middle distribution, half make more, half make less. And it shows that in 1996, a year for which we happen to have good data, family premium took 10% of median family income, and today it's 21%.
Nichols says the rise in health care costs and insurance premiums is the reason many Americans can't afford access to coverage.
Medicare and Medicaid are indeed what we spend our money on in the public sector, but Medicare and Medicaid are really just what we buy from the system as a whole for our most vulnerable people.
Nichols is the director of the Center for Health Policy Research and Ethics at George Mason University.
Government takeover is not 2,000 pages long. Government takeover is 2 lines. You're all in Medicare starts in July. Okay, 2,000 pages is trying to take a whole bunch of ideas and fit them into a phenomenally complex system without blowing it up.
He says as access to care increases under the Patient Protection and Affordable Care Act, the health system as a whole needs to move away from trying to provide as much volume as possible.
Technically, it's about signaling that business as usual is over, and business as usual is over because we cannot afford it. Fee-for-service medicine is a wonderful idea if you have unlimited budgets. We don't. And so, since we know it increases volume and leads to more volume than we need, we know we got to figure out a better way. No one can write down the math of what the better way is exactly, but we're pretty sure encouraging volume without thinking hard about different things is probably not the way to go.
Nichols says the PPACA wants to develop incentive programs that, starting with Medicare, reduce costs and improve quality. But he says incentive realignment can't be left up to Washington. Successful healthcare reform requires physician leadership.
But the truth is, when you think about it hard, and you think about realigning incentives in a healthcare system with 8,000 CPT codes and 458 MSDRGs and about 6,000 ways to pay hospitals, to do that, you have to have the wisdom of Pericles. You may remember Pericles. He ran Greece for a couple of decades, had a good run there, golden age. And I don't want to burst your bubble about our elected leaders, but I'll just say in Washington, we don't have Pericles anymore. We have Barack Obama and Patrick Conway. Fine Americans, trying hard, but they are not Pericles.
Nichols says health insurance executives are just as nervous as physicians and hospital administrators. The PPACA ends the practice of risk selection, and he told the Academy members and guests, transparency helps create functioning markets.
For this to really work, we are all going to have to focus on total cost of care. Fundamental problem today, plans will not share total cost of care data because they're afraid of you knowing the truth. Ask yourself this question: why should we permit them to profit from your ignorance, from our ignorance?
The goal is lower prices, lower utilization, and higher quality of care. In the end, Nichols reminded the members of the Academy of Medicine, above politicians and plans, patients put their trust in their doctor. John Ogle, WCVE News.